Scanning the room. Alright, go ahead.
Come in.
Hi, how are you?
Good, how are you?
Good. My name is Megan. I'm a student at UDM, and I'm going to be performing a head-to-toe assessment on you today.
Alright.
Can I see your wristband?
Sure.
Can you tell me your name?
Lila Krizat,
Your birthday?
4/27/95.
And do you know where you are?
I'm at the hospital.
Okay, so patient is latent, alert, and oriented times 3. Are you in any pain?
I'm not.
Any allergies, medication, latex?
Nope.
Okay. So patient's posture is erect. She's dressed appropriately for the weather. There's no apparent odors coming off of her. She has no apparent signs of illness. Her speech and mood is appropriate, and she appears her stated age. So I'm going to start with your head. And I'm looking for any masses or lesions. And there is no apparent masses or lesions. She is warm to touch. Her skin color is appropriate for ethnicity. Her face is symmetrical, and there's no facial drooping. So I'm going to go ahead and start with your eyes. Can you just follow my pen light in?
Mm-hmm.
All right. And then just look right at me. Okay, her pupils are round and reactive. Her eyes are symmetrical on her face, and they're perla. And her conjunctiva is pink and moist. Can you go ahead and open up your mouth? Say ah. Her oral mucosa is pink and moist along with her tongue. Her uvula is midline along with her tongue. Her tonsils are a 1+. Can you just smile for me? All her teeth are there, and there's no apparent lesions or bleeding on the gums. Can you just close your eyes for me and tell me when you feel this, okay?
Mm-hmm. I feel it. Mm-hmm. Mm-hmm.
Okay. Can you smile for me? Puff out your cheeks. Frown. And cranial nerves 5 and 7 are intact. Go ahead and feel for your carotid pulse. Both a 2+. And there's no apparent signs of bruising. I'm going to go ahead and move on to your arms. You can just hold them out for me.
Mm-hmm.
She's warm to touch. There's no apparent lesions, scars, or masses on her arms. Do you have anything that you want me to look at?
Nope.
All right. Her skin color is appropriate for ethnicity. Her skin around her nails are intact and good. Her nail beds are pink and hard. Her capillary refill is under 3 seconds. Can you just go like this for me? There's no apparent signs of clubbing. And can you grasp my hands? And her strength is bilaterally equal. I'm just going to go ahead and feel for your brachial pulse. Which they're bilaterally equal 2+. Your radial pulses, which are also bilaterally equal 2+. I'm going to go ahead and listen to your heart sounds for you. Go ahead and start at the aortic, pulmonic, herbs, tricuspid, and mitral. We're all listening for 60 seconds for the apical pulse. Then I'm going to go ahead and come back up on the bell, starting with the mitral, tricuspid, herbs, pulmonic, and aortic. And there was no extra sounds heard, no gallops or murmurs. I'm going to go ahead and listen to your lung sounds now.
Okay.
Deep breaths for me. Can you just lift up your arm for me?
Mm-hmm.
And your other arm. And can you just turn around so I can listen to your back? There's no apparent lesions or anything on the back. Okay, thank you.
Mhm.
Lung sounds are clear in all fields. Can you just go ahead and lay back for me?
Oh, sure. Thank you.
I go ahead and inspect. Her contour is flat. Her umbilicus is benign and there's no scars or lesions on the stomach. Going to auscultate, starting in the right lower quadrant. And bowel sounds were heard in all 4 quadrants. Tympanic sounds were heard over all 4 quadrants. And I'm going to go ahead and palpate. If you feel any pain, just let me know.
Okay.
Any pain at all?
Nope.
Okay, so there's no noted tenderness. I'm going to go ahead and name the organs now. In the right lower quadrant, you have the right ureter, the right ovary, the appendix, and the ascending colon. In the right upper quadrant, you have the liver, the gallbladder, the head of the pancreas, and the right kidney. In the left upper, you have the stomach, the spleen, the body of the pancreas, and the left kidney. And in the left lower, you have the left ureter, the left ovary, and the descending colon. You can go ahead and sit up for me. As she was sitting up, I was looking for JVD, which there was no apparent signs. You can go ahead and swing back over this way.
Mm-hmm.
I'm going to go ahead and look at your lower extremities. There's no signs of edema. She's warm to touch. Skin color is appropriate for ethnicity. Go ahead and listen to your popliteal pulse. Your bilaterally 1+. Your tibial pulse. Bilaterally 2+. And your dorsalis pulses. Which are bilaterally 1+. I'm going to go ahead and do the Babinski test on you. Which there was flaring of the toes, which means it's negative. Can you go ahead and stand up for me?
Sure.
Just let me know if you feel any tenderness, okay?
Okay. Nope. Nope.
Okay. Her diameter is 2 to 1. Can you just go ahead and touch your toes for me?
Mm-hmm.
Her spine is aligned correctly. Okay, go ahead and stand up.
Mm-hmm.
And just close your eyes. I'm going to watch her for 30 seconds for swaying. Okay, which there was slight swaying, but nothing too abnormal. Go ahead and walk to that side of the room and back for me. And the patient's gait was appropriate, steady, and rhythmic. And we're done with your head to toe.